Now, we're not going through too many stretches for the lower back itself. A lot of injuries that we will find in clinic, the low back hasn't been the source of the problem. It's been from the hips, from the upper back, chest, or very specific problems in the spine that we'll be treating. So we don't really need to generate more movement into this area. It's all about core stability. So I will show you one stretch that is very effective. It's not the same stretch as we've been talking about previously, where we've been trying to lengthen. It's more of a self-treatment or a self-mobilizing exercise that we can do that very safely loosens the back up. And it's very good for first thing in the morning. As soon as you get up and the back feels a bit stiff, typically a patient will tell me it might feel a bit stiff for about half an hour or so. By the time they've got up and had a shower, it feels a bit looser. Doing these two stretches kind of brings that down to about 5 minutes, or it just alleviates it straight away. It works by spreading around your own body's WD-40 that it has in between the joints, and that's what you experience once you've been up and been around. The joints are moving, they're getting more mobile, and that synovial fluid, which is the WD-40 almost in between the joints, starts to work a little bit more. The ligaments and tendons relax down. So this is just a very quick stretch that we can do, and we're going to be reaching up, and all we're doing is reaching to the ceiling. It looks like it's not going to do anything, but it has a good effect. Now, the way that this would be done as a full-on stretch would be where you're leaning this way. Now, in clinic, we always follow principles of how effective it's going to be. If you've got a lower back problem, then leaning onto this side, you're just going to be compressing the joints together whilst you're stretching this side. So it's really not going to give us any benefit. When we reach up to the ceiling and we start to just try and reach each side up as high as we can, then it's going to be lengthening the spinal muscles each side. Okay, that's these ones just here. And as we're reaching up just there, it's lengthening here. And as I reach up here, it's going to be lengthening there as well. So by doing that, you only need to do about 10 or 15 of these. They've found that you'll get as much benefit from just doing 10 to 15 as you would do from doing 100. And if it's first thing in the morning that this stretch is going to be most useful, just 10 or 15 and then you're up and running. The next one involves moving the joints forwards and backwards. Okay, so this is another stretch for the lower back. As I said, we're not fully stretching, we're really mobilizing. Okay, so we've done our reaching up to the ceiling, we've done 10 or 15 of those. This one, we're going to be pumping the fluid in the joints by moving the low back gently forwards and backwards. It's going to be a nice rocking motion. Okay, now we're not going to confuse this with a full stretch. In that position, a full stretch people will often see is when you're going into this position just there. And again, that's a really good stretch, but only for people that it's going to be beneficial for. For others, it's just going to cause low back pain, or it's going to cause a strain to build up. Okay, so we're not going to be stretching into that position. We're just going to take it to the point where we feel that it's a bit tight, and then we're going to be taking it forwards. So this exercise is called the cat-camel. We're going to set ourselves up in this position, and then we're going to be rounding the back, and then we're going to be arching it this way. You've got to stick your bum right up, and we're not holding it, we're just going backwards and forwards nice and gently. And it's fine if your range of motion is only this. You're just taking it backwards and forwards however far is comfortable. If you've got quite a bit of pain in the low back, you might just want to rock forwards and backwards like this. And again, you can just take it as far as you need to. But in that position, it's going to be rocking and opening the back joints. These are all the joints that we're going to be stretching, and it's really just taking it forwards and backwards, just like this, and it's going to be getting a little bit of movement into the spinal joints just there, moving that WD-40 around, and it's just going to speed things up. So as I said, typically if your back is really stiff for 30-45 minutes, just doing 10 or 15 of both of these just really helps to get things going for the low back first thing in the morning.